There is a question from parent asking, my child always complains about leg pain in night.
So this is a very common question asked by parents. My child is having leg pains in the night. So what does it mean? It is called growing pains. So there is a particular terminology for it. It's called growing pains in children. So what happens is every day, like intermittently, once in a while, the children complains lot of pain in the both calf muscles. Calf muscles means the back of your legs. So it is an intermittent pain. So it doesn't occur daily, but at least twice a week or thrice a week, they complain of severe pain at the end of the day, like during the evening terms or in the night times. So the child complains of severe pain, even awakening from the sleep, and the parents are often worried why the child is getting up from the sleep and complaining of the pain. And the next day morning, the child is perfectly okay, running around without any pain. So it is a growing pain. It's called growing pain. There's a terminology for it. So it is an intermittent pain which doesn't occur daily. It is a benign. So what does it mean? Benign means it is not a serious condition. It is a very, very common condition which easily go away after like the child reaches around 10 years or 8 years. It will easily go away. So there is no treatment required for it because it's a very, very normal condition which parents need not worry at all. So how will you differentiate? Why should you go to a pediatrician and tell that your child is having such kind of pains? Because the pediatrician will identify whether the pain is a benign one or the pain is something which has to be treated. Suppose if the child is complaining of pain in the muscle, and suppose if the joint, there is some swelling over the joint, or some redness, or some tenderness. Tenderness means whenever we are pressing the joint, the child is having a sharp pain. Suppose if those features are there, definitely that comes under a different category. It is not growing pain. So the pediatrician will tell you whether it is a normal type of pain which can easily be uh, relieved by a normal medication, or should we take a medical help, or rheumatologist should see, or any other rheumatological conditions also comes under the same category. So always try to go to a pediatrician and explain the problem. But most of the night pains, what the child is complaining are the normal growing pains. There is no reason for it actually, but in some studies, lesser vitamin D levels in our body is one main reason for this growing pains. So try to get vitamin D levels checked up in your children. Suppose if the vitamin D levels are low, your doctor will give you the exact correction for it, and the growing pains can easily be relieved. And sometimes simple paracetamol in the midnight, suppose if the child comes with a lot of pain, gets up with a lot of pain, you can give simple paracetamol that will help to relieve the pain. So for the growing pains, you need not worry. Suppose if you find any swelling over the leg, or any tenderness or any redness, then immediately you take a doctor's help. Suppose if you can see nothing over there and child is only complaining pain, and morning the child is completely okay, then you need not worry.